This is Dr. Britt Talley Daniel MD, a neurologist and headache doctor. And today I'll be talking about Alice in Wonderland Syndrome Explained. It's an interesting story. Reverend Charles Dodgson, living from 1832 through 1898, was better known by his pen name, Lewis Carroll. And he was an English writer, mathematician, clergyman, and early photographer. His most famous writings are Alice's Adventure in Wonderland and the sequel called Through the Looking Glass. Reverend Dodgson suffered from migraine with aura, and he projected the strained suffering of his own malady upon his characters, most typically Alice. Migraine can have features which are wherein the individual sees things very big, called macropsia, or very small, called micropsia. Other medical conditions are also associated with the Alice in Wonderland Syndrome. So Alice in Wonderland Syndrome Explained. Alice in Wonderland Syndrome, abbreviated AIWS, is the alteration of the sensations of vision and spatial location that come to patients who have migraine with aura and several other medical conditions. The syndrome is characterized by body image distortion and distorted perception of distance, size, shape, and spatial relationship between objects. The sensations of altered vision in space were described by Reverend Dodgson in his book, Alice's Adventure in Wonderland, by Alice as she fell down the rabbit hole. So, related questions. Who was Alice? Alice was named Alice Pleasance Hargraves née Liddell, her maiden name, born 1852, died 1934, who was, in her childhood, a friend of Lewis Carroll, the pen name for Charles Dodgson and the writer of Alice's Adventures in Wonderland. One of the stories Dodgson told her during a boating trip became the children's classic 1865 novel, Alice's Adventure in Wonderland. Who was Charles Dodgson, living 1832-1898? He was born in Daresbury, a village in northwest England, the third child of an Anglican clergyman. He had 10 siblings and didn't lack for company in life. Wakeling, who annotated his diaries later, said, quote, he told his brothers and sisters stories, made up games, and wrote magazines with them. From an early age, Dodgson wrote poetry and short stories, which were published in the family magazine Mishmatch, and later in other magazines, producing for him moderate success. Professionally, he was professor of mathematics at Christ Church, Oxford. He used the name Lewis Carroll for his fiction, producing his most famous stories, Alice's Adventure in Wonderland and Through the Looking Glass, and What Alice Found There. His poem, The Jabberwock and The Hunting of the Snark, were not as famous. Overall, he wrote 11 books on mathematics and 12 books on literary fiction. He was described as a man who enjoyed entertaining children, and they loved him in return. Throughout his life, he kept his mathematical writings, all published under his real name, Reverend Charles Dodgson, separate from his fiction, for which he used the pen name Lewis Carroll. What medical problems did Reverend Dodgson have? Charles Dodgson suffered from chronic migraine with aura, epilepsy, the speech impediment of stammering, partial deafness, trouble with facial recognition, lumbago, which is like pain in the back, recurring infectious diseases, synovitis, and ADHD. Although he claimed excellent health, he actually had many medical problems that bothered him for periods of time. Did Charles Dodgson have migraine? It's not clear what age he was when his migraine started. Migraine is considered to be a familial, genetically inherited, polygenic neurologic problem. The idea that Charles Dodgson had migraine is supported by his diaries. He described 5 attacks of migraine with vomiting. Interestingly, the current International Classification of Headache Disorders, version 3, requires 5 headaches, at least a migraine type, to make a valid diagnosis of migraine. Dodgson often reported a bilious headache with severe vomiting, and the phrase bilious attack is, in England, referred to as migraine. In a diary entry in 1880, Dodgson discussed experiencing his first episode of migraine with aura. In 1885, he wrote, quote, he experienced for the second time that odd optical affectation of seeing moving fortifications followed by a headache, end quote. Well, fortification is a term, a very specific migraine doctor term referring to migraine aura visual images, wherein the migraineur sees rectangular box-like images similar to the top of the wall of a fort. Because of his visual problem, he consulted an eminent ophthalmologist, William Bowman, in 1865, 5 years before writing Alice. He also published in his family journal a figurative representation of a person with the right half of the face, shoulder, and hand erased, compatible with a right paracentral negative scotoma, typical of migraine's visual aura. For this, see Podal and Robinson, 1999, who wrote an article in this called Out-of-Body Experiences and Related Phenomena in Migraine Art, written in Cephalgia in 1999. Did Reverend Dodgson's migraine experience affect his writing? It is assumed, although never clearly stated, that the unusual migraine symptoms he had, although never clearly stated, that the unusual migrainous symptoms Alice suffered in her journey through the rabbit hole were suffered also personally by Reverend Dodgson. How else would he be known to write about migraine symptoms in such an illustrious and fascinating fashion, unless he had migraine? Entries in Alice's Adventures in Wonderland that relate to migraine. These are actual dialogue snippets, quoting from the book. Alice said, she was considering in her own mind as well as she could, for the hot day made her feel very sleepy and stupid, end of quote. Well, migraine may be brought on by or worsened by heat. Alice said, the rabbit hole went straight on like a tunnel for some way and then dipped suddenly down, so that suddenly Alice had not a moment to think about stopping herself before she found herself falling down a very deep well. Well, migraine auras are commonly described as like a tunnel or having tunnel vision. Migraine patients oftentimes faint or have syncope, which comes with the sense of falling. Alice said, what a curious feeling. I must be shutting up like a telescope. And so it was indeed. She was now only 10 inches high. I'm opening out like the largest telescope that ever was. Goodbye, feet. For when she looked down at her feet, they seemed to be almost out of sight. They were getting so far off. Oh, my poor little feet. I wonder who will put on your shoes and stockings for you now, dears. I'm sure I shan't be able. I shall be a great deal too far off to trouble myself about you. Just then, her head struck against the roof of the hall. In fact, she was now more than 9 feet tall. Migraine patients may describe largeness or smallness of the visual perception. Migraine may cause feeling part of or the whole body as larger. That's called macrosomatogenesia, or smaller, called microsomatogenesia, than usual. Micropsia is a neurologic condition affecting human visual perception in which objects within an affected section of the visual field appear larger than normal, and micropsia is just the opposite. Objects appear smaller than normal. Micropsia can cause it to person feel smaller than they actually are, and micropsia are larger than they are. Paleonopsia, Greek again, paleon means again, and opsia for seeing, is the persistent recurrence of a visual image after the stimulus has been removed. Teleopsia is a vision perception disorder in which objects appear much further away than they are. Teleopsia is a disorder associated with dysmetropsia, which means any of a group of visual illusions involving an alteration in the size or separation of perceived object. Teleopsia relates to Alice's far-off feet, that she had all these unusual syndromes. Curiouser and curiouser, cried Alice. She was so much surprised that for the moment she forgot how to speak good English. Oh, dear, how puzzling it is. I'll try if I know all the things I used to know. Let me see. 4 times 5 is 12, and 4 times 6 is 13, and 4 times 7 is, oh, dear, I shall never get to 20 at that rate. However, the multiplication table doesn't signify. Let's try geography. London is the capital of Paris, and Paris the capital of Rome, and Rome, no, that's all wrong. I'm certain I must have been changed from Mabel. I'll try and say, how doth the little, and she crossed her hands on her lap as if she were saying lessons and began to repeat it, but her voice sounded hoarse and strange, and the words did not come out the same as they used to. Well, here Alice experienced aphasia while in the woods, where things lacked names. She knew a tree but could not name it, and couldn't remember her own name. Migraine patients may have aphasia, which means trouble naming or producing normal speech. They may also have confusional migraine, wherein they're very confused. Alice speaking again. There was no label this time with the words "drink me," but nevertheless she uncorked it and put it to her lips. I know something interesting is sure to happen, she said to herself, whenever I eat or drink anything, so I'll just see what this bottle does. I do hope it makes me grow large again, for I'm really quite tired of being such a tiny little thing. It did so indeed, and much sooner than she expected. Before she had drunk half the bottle, she found her head pressing against the ceiling and had to stoop to save her neck from being broken. She hastily put down the bottle, saying to herself, that's quite enough. I hope I shan't grow any more. As it is, I can't get out the door. I do wish I hadn't drunk quite so much. Alas, it was too late to wish that. She went on growing, and very soon had to kneel down on the floor. In another minute, there was not enough room for this, and she tried the effect of lying down with one elbow against the door and the other arm curled around her head. Still, she went on growing, and at last, as a resource, she put one of her arms out the window and one foot up the chimney and said to herself, now I can do no more. Whatever happens, what will become of me? So that's a meagreness distortion of body parts and space. As she said this, she looked up, and there was the cat again, sitting on a branch of a tree. Did you say pig or fig? Said the cat. I said pig, replied Alice, and I wish you wouldn't keep appearing and vanishing so suddenly. You make one quite giddy. All right, said the cat, and this time it vanished quite slowly, beginning with the end of the tail and ending with the grin, which remained somehow after the rest of it had gone. Well, I've seen a cat without a grin, thought Alice, but a grin without a cat? It's the most curious thing I ever saw in my life. This Cheshire cat's smile is like the description of a luminous, bright, C-shaped arc that flickers or exudes light. It's a meagrenous aura that comes and goes. When it disappears, it's like a scotoma or blind spot, which are all typical of meagrenous auras. Where the noise came from, she couldn't make out. The air seemed full of it, and it rang through and through her head till she felt quite deafened. So Alice here experienced sensitivity to sound called sonophobia, which means fear of sound. Well, what is the etiology of Alice in Wonderland Syndrome? There are multiple etiologies here, which is thought to reflect either cerebral perfusion or cortical spreading depression. So the etiologies are, and it's a long list, headaches, migraine, abdominal migraine, cluster headache, tension-type headache, Handel syndrome, which is transient headache and neurologic deficit with spinal fluid lymphocytosis, epilepsy, complex partial epilepsy, frontal lobe epilepsy, infectious diseases, the Epstein-Barre virus, Coxsackie B1 virus, cytomegalovirus virus, influenza A virus, mycoplasma, varicella zoster, typhoid encephalopathy, Lyme neuroborreliosis, Streptococcus pyogenes, which is scarlet fever and tonsillopharyngitis, perinfective vasculitis, cerebral vascular diseases, intraparenchymal hemorrhagic stroke, ischemic stroke, cavernous angioma, I told you there's a long list, Robin-Hood syndrome, pituitary infarction, other organic brain diseases, acute disseminated encephalomyelitis, glioblastoma, psychiatric disorders, depressive disorder, Cotard syndrome, Capgras syndrome, schizophrenia, schizoaffective disorder, drugs, dextromethorphan, cough syrup containing hydrocodone and methylephedrine, montelukast, topiramate, LSD, getting to the end here, hallucinogen, persisting perceptive disorder, and LSD withdrawal, and finally, toluene-based solvent. Here's a case report of Alice in Wonderland Syndrome regarding etiology. Randy Evans from Houston wrote in Headache in 2006 on reversible paleonopsia and the Alice in Wonderland syndrome associated with topiramate use in migraineurs. 2 patients are reported who developed paleonopsia while taking topiramate for migraine prevention, which resolved or decreased in frequency or duration on lower doses, but recurred or increased in frequency on or duration on higher doses. Both patients had complete resolution of paleonopsia when topiramate was discontinued. A 3rd patient is described who developed the Alice in Wonderland syndrome about 1 week after starting topiramate for migraine prevention, with complete resolution of symptoms about 1 month after stopping. Topiramate use may cause paleonopsia and may be associated with Alice in Wonderland syndrome through an unknown mechanism. Mastria et al., writing in Biomed Resolution in 2006 on Alice in Wonderland Syndrome, a clinical and pathophysiologic review, stated, out of 166 cases of Alice in Wonderland Syndrome published, the most common cause is migraine, 27.1%, followed by infections, 22.9%, principally EBV infections, 15.7%. In decreasing order, other etiologies are as follows: brain lesions, 7.8%, medicament, 6%, and drugs, 6%, psychiatric disorders, 3.6%, epilepsy, 3%, disease of the peripheral nervous system, 1.2%, and others, 3%. In about 20% of patients, no cause of Alice in Wonderland syndrome was found. What is the pathophysiology of the Alice in Wonderland syndrome? The symptoms relate to ischemia or cortical depression of temporal-parietal occipital brain regions. Ischemia refers to decreased amount of oxygenated arterial blood. Cortical spreading depressions, abbreviated CSD of Liao, refers to a short-lasting depolarization wave that, in patients with migraine with aura, moves across the cortex at a rate of about 3 to 5 milliliters per minute. A brief phase heralds the reaction, which is immediately followed by prolonged nerve cell depression synchronously with a dramatic failure of brain ion homeostasis, efflux of excitatory amino acids from nerve cells, and enhanced energy metabolism. Mastria, again, et al., stated, Alice in Wonderland syndrome is a perceptual disorder principally involving visual and somesthetic integration, firstly reported by Todd on the literary suggestion of the strange experiences described by Lewis Carroll in Alice in Wonderland books. Symptoms may comprise, among others, ischematia, dysmetropsia, migraine, and Alice in Wonderland symptoms. The final part of this review aims to find the relationship between Alice in Wonderland symptoms presenting a pathophysiological model. In brief, Alice in Wonderland symptoms depend on an alteration of the temporal parietal occipital brain, where visual, spatial, and somatosensory information are integrated. Alterations in these brain regions may cause the co-occurrence of dysmetropsia and disorders of body schema. In our opinion, the association of other symptoms reported in the literature could vary depending on different etiologies and the lack of clear diagnostic criteria for the syndrome. A SPEC study revealed hypoperfusion in the temporal occipital lobe and perisylvian area during an acute stage of a patient who had Alice in Wonderland syndrome. Interestingly, a functional MRI scan study during an episode of micropsia in a child with the syndrome revealed contemporary hypoactivation in the occipital lobe and hyperactivation in the right superior parietal cortex. Moreover, in the same study, when a size comparison-based visual task was used in the same patient with micropsia, hyperactivation of right superior and bilateral inferior parietal cortices was found. What about medical cases with Alice in Wonderland syndrome symptoms? Nabil Kitchener wrote on Alice in Wonderland syndrome in the International Journal of Child Neuropsychiatry. His case shows the problem of just relating this only to migraine. His case 1 is presented. A previously well 9-year-old boy with sudden onset of strange sensations, illusions of size and shape of the blackboard in his classroom called micropsia and distortion, disappearance of colors of objects including chalk and dress, then decrease in the size of his head and left upper limb. He was alternately very tall, he seemed, or shrinking, then his left hand became huge. Sounds were abnormally loud, all of these followed by a throbbing headache. During episodes, the patient was alert but slightly disoriented to place. He said, "Where am I?" The episodes lasted approximately 15 minutes and occurred twice per week for 1 month before diagnosis. There's no history in his case of seizures, psychiatric disorder, head trauma, or infection. No medicines had been given. He didn't take street drugs. Their family history was of migraine. His general neurological, psychiatric, and ophthalmological examinations were all unremarkable. Lab and head CAT scan were normal. EEG showed right temporal-parietal epileptogenic discharge. He received a conventional anti-epileptic, complete resolution at a full dose. This proved that he suffered from complex partial seizures, which can cause Alice in Wonderland Syndrome. Mastery, again, et al. From above reports. The first that used the term of Alice in Wonderland Syndrome was Todd in 1995. He described 6 cases, 4 were migraineurs, reporting mainly some aesthetic symptoms of feeling part of or the whole body as larger. That's macrosomatonausea, or smaller, which is microsomatonausea, smaller than usual. These symptoms were also associated with either visual illusions, including dysmetropsia, namely macropsia and micropsia, obviously other people appearing bigger or smaller, and teleopsia and paleopsia, objects or other people appearing respectively farther or nearer, or disorders of consciousness as feelings of derealization, depersonalization, somatopsychic duality, the idea to be split in two, or vertically in the middle, an alteration in judgment of time. Some other symptoms that have been reported within the spectrum of Alice in Wonderland Syndrome are kinetopsia, auditory hallucinations, and verbal illusions, hyperacusia, hypoacusia, dyschromatopsia, zopsia, and complex visual hallucinations. William Gowers, the famous neurologist in 1907, reported that patients with seizures experienced, quote, feelings of unreality in what is seen, period, in a quotation. Hermann Oppenheim, in 1913, wrote that a patient with violent migraine had, quote, indescribable feelings of detachment of trunk or an extremity, end of quote. MacDonald Critchley noted that patients with migraine or seizures arising in their parietal lobes perceived objects as smaller, micropsia, or larger, micropsia, than they were. And Dr. Critchley was a famous neurologist, greatly interested in the parietal lobes and wrote about it a lot. Carl Lippmann in 1952 claimed that he was the first to describe migraine patients with hallucinations of their body splitting in half and the remaining half shrinking or growing excessively large. Lippmann proposed that Lewis Carroll, Charles Dodgson's nom de plume, described his own migraine illusions in Alice in Adventureland in 1865 to entertain Alice Liddell, who was the daughter of his dean at Christ Church College, Oxford, England. Ali Ulvi Uka and Hassan Kozak reported in the Balkan Medical Journal in 2015 on the Alice in Wonderland Syndrome, a case of aura accompanying cluster headache. Cluster headache is the primary headache disorder which has highly specific and sensitive criteria and not presence of an aura, usually. It's been recently reported that a cluster headache may not present with aura more than ever, and this condition will be identified by headache specialists as a new form of chronic cluster headache. As there's no report to our knowledge on Alice in Wonderland Syndrome manifested as cluster headache in the literature, we present a case of a 35-year-old man having this. Clinically, Alice in Wonderland Syndrome is not uncommon and is likely to be underestimated as a diagnostic entity, and valproate may be preferred for treatment in patients with cluster headache. with Alice in Wonderland Syndrome, ARA. ARAs have been described to occur in associations with cluster headache, hemicrania continua, even with chronic paroxysmal hemicrania. In chronic cluster headache, ARAs have been reported in 20% of patients. We describe a 35-year-old man with Alice in Wonderland Syndrome manifested as ARA of cluster headache. So the case presentation. A 35-year-old male patient with a 4-year history of episodic cluster headache has been examined in the outpatient clinic. Pain attacks repeated 3 to 5 times a day, lasting 0.5 to 1 hour for 3 to 4 weeks, with no pain noted for 1 year afterwards. Pain was defined as to be localized in the left orbital and periorbital region. The headache was defined by the patient to have a severe and throbbing nature, coexistent with one-sided, on the same side of the headache pain, conjunctival hyperemia and nasal congestion. During the attacks, the patient indicated receiving subcutaneous sumatriptan, which is a acute therapy drug for migraine, and he used methylprednisolone as prophylactic treatment. The pain attacks commencing in this area were different compared to others, manifested as a perception of enlargement of the left side of the head, a length increase in left-sided extremities, a slowing down of overall movements, surrounding objects appearing to be far away or smaller, color changes of the self and surrounding objects such as hair or dress lasting 2 to 5 minutes just before headache onset. At that instant, the patient perceives himself as a giant with a great amount of fear. The patient has been reoriented to the psychiatry clinic with Alice in Wonderland syndrome findings interpreted to be psychiatric from the emergency service. He had no family history of migraine or other neurologic disorders. The patient did not have any history of drug abuse, depression, or psychiatric illness. Workup, including blood work, EEG, and MRI scan, were normal. He was first treated with methylprednisolone, but didn't respond until valproate was added. The dose increased to 1,000 milligrams a day. After that, he was headache and visual aura-free, following up for the next 3 months. The frequency of Alice in Wonderland syndrome. Epstein-Barre virus for some groups have been reported as the most common cause in children, but migraine attacks most common in adults. The syndrome is rare, and no good statistical data exists to document frequency. Mastra et al., writing in Biomed Res. Int. in 2016 on Alice in Wonderland syndrome, stated that this syndrome remains a poorly known and a probably misdiagnosed syndrome. Dooley et al. Wrote on Review of Alice in Wonderland Syndrome in Pediatric Neurology in 2014, and they followed up 28 pediatric headache patients who were observed by one of the authors in 1983, were contacted by telephone in 93, 2003, and 2013. Details were gathered regarding the presence and characteristics of ongoing headaches and about the presence of sleepwalking, motion sickness, and distortions of either time or space perceptions. The results were ongoing headaches were reported by 71%. Sleepwalking was only present in one patient. More than a third still complained of motion sickness, and more than 1/4 still experienced distortions of time. Distortions of space were still reported by nearly 20%. Reporting any of these phenomena was not consistent over time, and some patients were reporting distortions for the first time in adulthood. There was no clear correlation with migraine. Patients with attention-type headache also reported the phenomena. Well, what's the epidemiology of Alice in Wonderland syndrome? Due to the rare occurrence of epidemiology of this syndrome, it's not possible to report. There's a problem with standard classification of Alice in Wonderland syndrome, which limits statements regarding epidemiology. It's not clear what is Alice in Wonderland syndrome and what is not, so the exact prevalence is unknown, and there are no large-scale epidemiologic studies. It's not in the International Classification of Headache Disorders, version 3. What about genetic links? The genetics of Alice in Wonderland syndrome only relates to migraine part in patients, which is familial and polygenic. The most common cause of Alice in Wonderland syndrome, Epstein-Barre viral syndrome, however, is not genetically related. How about sexual preference? One study of the Japanese adolescents found the occurrence of micropsia and macropsia was 6.5% in boys and 7.3% in girls. There's no sexual preference for Epstein-Barre syndrome, but migraine occurs in 25% of women and 3 times more commonly in women than men, where the incidence is 6%. Age affected. One report said in 65% of cases, Alice in Wonderland syndrome occurred in children under 18 years of age. The neurologic workup. A complete medical and specific neurologic history oriented around migraine and Epstein-Barre syndrome and physical exams should be done. Testing such as blood work, CAT, or MRI scans should be done. Patients with Alice in Wonderland syndrome have showed abnormal perfusion in medial temporal, hippocampus, temporal occipital, or temporal parietal occipital regions. Here's a case report with special functioning MRI scanning. Brum wrote in Headache in 2006 on functional magnetic resonance imaging of a child with Alice in Wonderland syndrome during an episode of micropsia. He stated, Alice in Wonderland syndrome is a perceptual disorder involving brief, transient episodes of visual distortions, such as metamorphosia, and can occur in conjunction with certain viral infections also. We use functional magnetic resonance imaging to examine visual processing in a 12-year-old boy with viral onset Alice in Wonderland syndrome during an episode of micropsia, reduction in the perceived size of a form. Results. In both tasks, the child with Alice in Wonderland syndrome showed reduced activation in primary and extrastriate visual cortical regions, but increased activity in parietal lobe cortical regions as compared with a matched control participant. Conclusions. The active experience of micropsia in viral onset Alice in Wonderland syndrome reflects aberrant activity in primary and extrastriate visual cortical regions, as well as parietal cortices. The disparate patterns of activity in these regions are discussed in detail. What about the duration of attack? Epstein-Barre viral syndrome has a duration of 2 to 4 weeks, although symptoms of Alice in Wonderland syndrome don't last that long in those patients. Migraine headache by diagnosis can last 4 to 72 hours, but our symptoms should be less than 60 minutes. Partial complex seizures usually last less than 30 minutes. The usual Alice in Wonderland symptoms are transient and last less than 30 minutes. Treatment. The associated medical problem should be treated if possible. For example, valproate treatment in a young boy with Alice in Wonderland syndrome and partial complex seizure cited by Brum earlier, but there's no specific treatment for the symptoms of Alice in Wonderland syndrome otherwise. Prognosis. The prognosis of Alice in Wonderland symptoms, which are transient, usually resolve, leaving no lasting symptoms or residua. The problem there is counseling relieving anxiety in affected patients, which are usually children and their parents. So I'm going to stop now on my discussion now of Alice in Wonderland Syndrome Explained. I hope I've done that. Please stay on YouTube to look at my other podcasts on migraine. God bless any of you children or adults who've had this syndrome. And you can follow me also on my migraine blog at www.drmigraine.com. I'll see you on the next podcast.